Welcome everyone to our final Q&A session for 2020 with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us again today.
Yeah, of course. It's hard to imagine a year's gone by.
Already, and we have been doing this for over 8 months now with the doctor. She has been patiently answering all of our questions, tirelessly finding us the answers every week. So I just wanted to quickly address how we run these sessions because there were some concerns last week, and I want to make really clear how we do this. Essentially, what we do every week is about 3 or 4 days before we do these sessions with the doctor, we put out calls on our social media, which is usually Facebook and Twitter, to get questions from our wonderful viewers and our listeners. You guys submit all of your questions, we get them and we moderate them. And when I say moderate, it just means that I compile them into a logical sequence of questions because sometimes there's a lot of similar questions, and then I present them to the doctor. The doctor does not know what we're going to ask her every week. It's completely blind. We put her on the spot and she just gives us the answers that she has. When it comes to live questions, you can continue to submit your live questions underneath this broadcast, and we try to get to as many as we can. Unfortunately, sometimes we don't have the time, or a lot of those live questions have already been answered earlier in the session, or they're repeat questions, so we don't always get to them. However, if it's something that we have not heard from yet, we try to get to it. It's all about timing. It's all about when the question comes in. It's how much time we have left in the live session as well. So rest assured that these are all your questions coming from you. I didn't make them up. I didn't give the doctor them before that. It's all generated by our viewers and listeners. So having said that, doctor, are we ready to go for this last session of the year?
Yeah, and I want to say I enjoy the questions. I have no idea what's coming for me in this half hour. So yeah, let's get going.
Excellent. Okay, let's do this. So this week, again, we're going to start with some vaccine questions because that has been on everybody's mind, top of mind recently. Let's start with wings. This person is actually a regular submitter of questions, so I love it. Let's go with him. With the new strain of COVID-19 in the UK, is the current vaccine effective? Is COVID-19 behaving like the common flu, which mutates every year?
Yeah, so there's a lot more that we have to know about this new strain. What we do know in general is that viruses do change. I mean, that's what viruses do. We know that very well about the flu, and now we're learning more about this SARS-CoV-2, the virus that causes COVID-19. I think the one thing that we can know for sure, though, is that if we continue with our public health precautions, we're likely to catch most of the variants of the virus, that even if it changes, it mutates, the way we can prevent it is the same. Now, the vaccines that we have, the Pfizer vaccine and also the Moderna vaccine, it targets one particular, it's called the spike protein. Mm-hmm. And so the question is that spike protein much changed in the variant? Even if it's changed a bit, but not a lot, sometimes the vaccine can actually give you cross protection without the exact match. And so I think that bodes well for the vaccine. But again, time will tell us that for sure.
Okay. Because like you said, this is not the same as other vaccines. This is a different technology that we're using, so it might even work for other strains.
That's right. It targets things in different ways compared to the flu vaccine. The flu vaccine, we know the way the vaccine targets the strain of flu that's circulating, it may not always be a good match. For this one, because it's targeting the spike protein, and if that protein stays mostly intact, the vaccine should still give us good protection.
Right. Okay. And then let's move on. Donna asks, and this was actually a question that came in, I believe, from Jen last week, and we had no more time left. So let's go to Donna's question. Is it safe for a young woman who may want to get pregnant soon to get the vaccine? What if they're already pregnant?
So we're recommending, if you are already pregnant, that, we're saying not to get it because there have been no studies that have been done to look at how the vaccine works in pregnancy. There have been some people who were pregnant and got vaccinated, either they got the vaccine and then got pregnant thereafter or didn't know they were pregnant. And those babies have not yet been born. And so we don't quite have all of that data. Now, what we do recommend, though, is that if you are pregnant or planning to be pregnant, have a conversation with your doctor to decide, especially if you're pregnant right now, do the benefits outweigh the risks for getting the vaccine? If you're planning to get pregnant, well, get the vaccine. Like if you're eligible, you can get it. And then you could just wait about a month or so, or 2 months, they're recommending in the UK, before you decide to get pregnant. But you wouldn't need to wait for much longer than that.
Right, okay. But like you said, those who are already pregnant, it's not being recommended right now because we don't know the effects of it.
It's just based on the data. And so that's why if you choose to get it when you're pregnant, it's based on a balance of your own personal benefits and risks.
Right, absolutely. Okay. And then Khalid asks, Khalid says he is 74 years old and is on Remicade infusion every 6 weeks. When his time comes, should he get the vaccine?
So again, if you're on a medication that makes your immune system weak, then again, you're going to have a conversation with your doctor on this. There are a lot of really good medications that work for different kinds of illnesses, but they actually weaken your immune system. And those people who were on those medications weren't studied as of yet. And so that's why we can't make a broad recommendation to say anyone who's on these medications should get vaccinated. But with that discussion with your doctor, you can decide if the time is now or whether it's time to wait.
Okay. And then Sandy asks, is there iodine in the vaccine? If one reacts to iodine contrast dye, is the vaccine safe for me?
The list of ingredients is available on our Toronto Public Health website. We have a specifics page on vaccines. I don't remember that iodine was one of the ingredients that was in there. The commonest ingredient that people have allergies to is this PEG, polyethylene glycol, which is actually in a lot of things, laxatives, makeup, even foods and drinks have it. So, but iodine is not one of them.
Okay, perfect. Doreen asks, is the corona vaccine guaranteed for life, like say the polio vaccine?
We don't know yet. And so we do know with some vaccines, you have to get, like in this case, you get one vaccine and then you get a second dose. That's like a booster dose. Will you need another booster dose, say in a year or in 5 years and 10 years? We don't know the answer to that yet. And so hopefully time will be able to help us determine that.
Right. And then this is a question that we've had multiple times, so I'll sort of try and put them all together. We've got Poor Canuck, Mauricio, and Vin who have a similar question. Basically, do all of the people, over 400,000 people that have recovered from COVID, still need to get the vaccine? If you've had COVID already, do you need to get the shot?
So again, this is one of those places where the studies actually tried to exclude people who already had COVID, but there's no reason to think that you can't get it. We know that if you've had a natural infection, you got COVID, there have been cases of people who have gotten COVID again, that reinfection, and so getting vaccinated would still be considered a good idea.
Okay. Okay, Mala says, for the record, she's pro-vaccine and will take any vaccine that doesn't require risking her life. But she says, I would like to know why we can't identify which food allergies the vaccine may trigger. It feels like we aren't being given an honest list of what it contains. And as a person with allergies that can kill me, this is very worrisome to me.
Yeah, so good question. So I think early on when we learned about the few cases in the UK of the anaphylaxis, the recommendation was if you have any severe allergies, don't get the vaccine. Well, we've since honed that and narrowed it down to say it's really that polyethylene glycol that's the contributor. That's the ingredient that's caused most of those anaphylactic reactions or the severe reactions. And so that's the ingredient you need to worry about. And if you otherwise have an allergy to eggs or shrimp or, any other thing, the vaccine is considered safe in you. Now, if you're concerned that you have severe allergies in general and want to be a bit more cautious, by all means, talk to your doctor, talk to your allergist. It may be the kind of thing that you get vaccinated and you wait instead of for 15 minutes, maybe for 30 minutes, just to be on the safe side that you don't develop a reaction. But right now, the only reasons not to get vaccinated are if you have a specific allergy to any of the ingredients.
Okay, and speaking of PEG, polyethylene glycol, you said, that particular ingredient is found in other medications as well?
Exactly. So Tylenol, liquid Tylenol, It's found in, if anyone takes a laxative, there's a laxative called PEG, actually, Restoralax is actually PEG, for example. So there are a number of different ways in which people may have interacted with this. And that's why if you actually have an allergist, they probably would have identified this as an allergy for you if you have severe allergies.
Right, okay. Let's move on. DC asks, once frontline health workers, the elderly in care homes and people caring for them are vaccinated, how will the people who have comorbid conditions and are next in line to be immunized if Pfizer's vaccine needs special freezing and thawing and can't really be carried out in like your general practitioner's office? How will this group be notified, and how and when will all of this occur?
Okay, so a lot of good logistical questions. So how will you be notified? Well, we're waiting for the vaccine task force. The provincial one is likely to release who is their second priority group who will be eligible for the vaccine. And then to give more details on where you can get it. So yeah, the Pfizer vaccine right now, where it is where you can get it. And so there might be, for example, large community clinics, like Toronto Public Health has flu clinics in the community. It might be something like that, you come here to get the vaccine. We'll tell you through the media, through your doctor, these are the people who are eligible. The other point to know is we're expecting that the second vaccine, the Moderna vaccine, should be coming out. And that might have a bit more mobility to allow the vaccine to be in, for example, your doctor's office. We're also waiting to get results from Pfizer studies on is actually the vaccine able to be a bit transported a little bit more? And so that might also help going forward.
Okay, so actually you mentioned the Moderna vaccine, and we have a related question to that right now. Ashley was asking, what is the ETA on the Moderna vaccine?
Yeah, so we're waiting for it. I mean, we're close to the end of the year. If we get it by the end of the year, it will be great. So really it's a day by day. We'll have to wait and see.
Right. And of course, it has to be, go through our own testing from Health Canada before it can be approved and for use.
That's right. So it's the Health Canada approval that we're waiting for. And then once it's approved by Health Canada, then we have to see what the timeline is for the manufacturer to be able to send the vaccine into the country. But first we need the approval. Yeah.
Right. Okay. And so Phyllis asks, COVID-19 is a coronavirus. The common cold is a coronavirus. There are no antibodies. So how exactly does the vaccine work with no antibodies? She says that even with the vaccine, she's noticing that, the recommendations are to maintain your social distance and wear a mask and live in your bubbles. So then what is the value of this vaccine?
Okay, a lot of really good questions in that as well too. So let's talk about how the vaccine works. The vaccine works, you get the injection. With the injection, you have, it actually causes your body to produce a response against the spike protein. And so what you inject is the RNA. The RNA gets incorporated in some of your cells to produce the spike protein. The spike protein is then in your body. It says, you've been infected. You need to be able to mount an immune response. And so your body then starts producing the antibodies. So you're right, there's no antibodies in the vaccine. It actually relies on your body to produce those antibodies. That's why actually you feel not so well. Some people a few days later, you could get a fever. That's all part of your body's immune response, developing those antibodies. It will then attack that spike protein that's inside your body and get rid of it. And what you're left with is the antibody. So that's how the protection is going to work. But now the thing about, wearing masks and gloves, not gloves, but masks and keeping a distance, why do we still need to do that? Well, first of all, in order to have population-wide protection, we need many people vaccinated. That's that herd immunity concept. And so that's going to take time. We don't have enough vaccine to vaccinate all 20 plus million Canadians as well. And then we also have to make sure that we know the vaccine. If I get the vaccine, it will protect me against disease. It will protect me against illness. What we need to still get some more answers to is, will it prevent me from getting, say, an asymptomatic infection that I can't spread to others? That piece we're still waiting on some information for, probably, but we're not sure yet. So that's another reason why we're going to need to keep doing those things until we're confident we've got this virus under control.
Right, and until we reach that point of herd immunity when we know that we're all more or less safe.
That's right, yeah.
Okay, and then Bernice asks, will a vaccine be made for kids under the age of 12 years? Because currently I think the recommendation is 16 and over, right?
That's right. And so with the Pfizer vaccine, 12 to 15-year-olds have been studied. But we know that there will be ongoing studies for the younger children. Also, with the new vaccines to come, some of them may be studied in younger children as well. So you can expect that there will be something available for children and they won't be left out
Right.
in the longer term. Yeah.
And so you just mentioned this, but probably best to reiterate this separately. Erica asks, if I get vaccinated, that means I'm not going to get the virus or pass it on to anyone. What is the protection that it is providing?
So right now we can confidently say that the protection is that you will not get sick. So you won't get an infection that will make you sick. It's that second part that we're still waiting for some of the data to show us whether it will prevent you from spreading it to others. And so it's not that we just don't have the data on that yet. And so that's the part that we're still waiting for.
Okay. We have a live question coming in right now. Giacomo asks, if I'm allergic to NSAIDs, am I able to get the vaccine? I hope I said that right. NSAIDs.
Yeah, so NSAIDs, these are like ibuprofen, aspirin, naproxen, anaprox. So yes, there's no contraindication for you to get the vaccine if you have that allergy.
Okay, wonderful. And then we'll go back to the questions that were submitted over the week. T asks, can you get tested for COVID antibodies after receiving the vaccination?
So that's actually what they've done in the studies. That's how they can kind of show that you're getting a response, is they test those markers to see what kind of a response you got in your antibodies. It's not something that we are going to recommend routinely. And we usually don't do that with vaccines. We rely on the studies to show us, yes, you get a response, your antibody response after vaccination. Continue to test those people who were in the study, but ongoing, once you have the 2 doses, no more testing is required.
Okay. And then we'll move on to some non-vaccine questions, lots more of those as well. 3 people have actually asked about PCR testing this week. There's Mast, Moose, Farah, and Brad. And the questions are all around the cycle thresholds of PCR testing. So I'll read out Mast Moose question. I've been seeing a growing number of voices complaining about how the PCR test is inaccurate because it will detect any residual viral fragments and an old infection that you may have already beaten. When the initial PCR test comes back positive, is any additional testing done? What can we say to people to reassure them about the validity of these PCR tests?
Okay, so we have talked before in this about pre-test probability. And so if you have symptoms, you've been exposed to someone, now you get tested, you test positive, we will take that positive as a true positive. If, however, you got asymptomatic testing, for example, you live in a nursing home, or you work in a nursing home, or maybe it was part of the school-based testing, and you have a positive, and we can't quite figure out, is that a real positive? Did you previously have an infection? Well, then in those situations, especially in someone who's asymptomatic who got tested, we will recommend that cycle threshold test, and that will help us. The way it works is it helps us to differentiate: is this a new test result, or is it likely to be, as the viewer said, more residual virus from a previous infection? So we don't do it for every single person because we don't need to, but where we need to, we will certainly ask for that additional test.
Okay, and then I think this is maybe a slightly different one, but I'll ask it anyway. Brad says, what is the cycle threshold used in the RT-PCR test in Ontario? Has that number changed?
So each lab has to develop their own cycle threshold value, whatever the cutoff value is for that lab. It's usually 30, 35, like usually it's around the 30s. And so depending upon what result you have, you would have to determine what the reference range is for that particular lab that did the test. And that's very common for all kinds of tests that are done in different labs.
Okay. And then one more question coming in live here. Andrew Mitchell asks, we just talked about this, but let's reiterate for Andrew. Is it true that the vaccine doesn't prevent the passing of COVID? That is, you may not get sick from it, but you can still transmit it.
We don't know the answer to that. So that we call that transmission, where you could have the virus. Classically, we talk about it, say, for someone who's asymptomatic. They don't know that they're infected and they could pass it to others. We don't know the answer to that yet. There is some early data from that may be available that we're hoping will be able to come out to help us answer that question.
Okay, okay. Okay, let's go back to the questions that we have here.
So you know what, it's important to reiterate one point though. If we think about the way the vaccine works, it's immunity to the spike protein, and as long as someone who's asymptomatic, it's an infection related to the spike protein, you will expect that the vaccine can work for those asymptomatic infections. It's just that we don't know right now. So it's not, it won't prevent, it's just we don't know yet.
Right, absolutely. So we're just waiting for the data to confirm that, because the hope is, or like the likelihood of it doing that is quite high.
We're hoping, yes, exactly.
Yes, fingers crossed. Okay. Okay, so we'll go back to these questions then. C asks, what are the chances of a false negative COVID test in someone with symptoms and high risk exposure to an asymptomatic positive case?
Again, part of it depends on, well, what test did you get? So you're talking about the PCR test. Did you get a nasopharyngeal swab, like the deep nasal swab, versus, you know, if you had a saliva collection or an anterior nasal swab, that again reduces some of the ability. You know, sometimes it's not quite as robust as that deep nasal swab. So if you have symptoms, you had a close contact, the result is negative, and then, you know, I would say take it as a negative, but continue to isolate, especially if you were in contact with someone. If your symptoms, though, don't get better or they get worse, that might be an indication that you go back and get tested again for sure.
Right, right. Kimber asks, if I tested negative for the antibody test, does that mean that I didn't have COVID back in early March when I didn't qualify for a COVID test?
It doesn't necessarily mean that. It just means that you had a negative test. And so if you have a positive, it means you have a positive test. That's all we know, because we know that the antibodies can wane when they're tested. They're not always present, and it's really hard to be able to say because you don't have antibodies, you didn't ever have COVID.
Right, right. Because we've talked about this before. We don't know how long those antibodies last. We don't know that if you've had COVID once in your lifetime, you'll be immune for the rest of your life. We don't know any of that yet.
That's right. Yeah, yeah.
Okay. Let's see. Maria asks, if I get tested positive and have no symptoms after 10 days except for the lingering cough, can my daughter sleep with me? She usually sleeps with me after 10 days.
Yeah, so you're considered contagious for the 10 days that you have symptoms. And exactly, as long as you don't have a fever, your symptoms are improving, mostly gone, except for that lingering cough, then you're not considered contagious anymore.
Okay. Ethan asks, do you think that schools should be closed in the new year?
So we're expecting an announcement now, probably even we're missing it. Yeah. So I think we'll have to wait and see. What we say is between now and the new year is still 2 more weeks. And so when it comes to schools, we're making decisions on what's the best way to protect the students and staff in schools on a daily basis. Okay.
Yes, there's a big announcement coming at 1 o'clock. So everybody needs to tune into that as well. We will be running that live on City News as well. Premier Ford is going to be making the announcement. So we'll keep going with our questions, and then we'll be done right at 1 o'clock, and you can switch over to that.
Yes.
So let's do this. Michelle asks, I live in Sturgeon Falls. Can I travel the 400 series highways to go to Woodstock for Christmas?
So the recommendation right now is that people don't travel. It's really not recommended. We know that the virus spreads from people who move about and have close contact with other people. That's exactly how the virus spreads. And so I would have to say you live in a lovely place, Sturgeon Falls, and it might be beautiful just to spend Christmas there.
Yeah, and Dan has a very similar question. Should we be traveling from province to province via airplane? And I guess the recommendation is the same, right?
The recommendation is to stay home for these holidays. Yeah, that's right.
Okay. This is a different one. Corey asks, can you use dish soap as a way to wash your hands to kill the germs?
So it depends on the dish soap. So classically, to get rid of COVID, you need something with alcohol, like an alcohol-based hand sanitizer. Soap in general is effective, yeah. And so if you wash your hands for 20 minutes, lather for 15 seconds or more, and then wash your hands, that should be enough to get rid of the virus, yeah.
So the type of soap doesn't really matter as long as it's soap and it's foaming and it's getting.
That's right.
Up.
Yeah.
Okay. Let's see. We've got a couple of questions regarding, I guess, regulations. Sam asks, 2 owners of Bar Karma were recently charged with opening their establishment. None of the patrons inside were wearing PPE. They were having a party indoors. As public health policy, why did the police not fine the patrons and just the owners?
So I am not an expert in enforcement. I think a lot of it has to do with the type of laws and regulations that there are. What I can tell you is it's up to each employer, each business to follow the regulations. That part is very, very clear. And so a lot of the responsibility falls to the business and the owner to make sure that they're following the protocols. And that was the case even in the beginning when we just had the mask bylaw in the city. It was the owner or operator of the establishment that had to make sure that they had a policy in place. So that's part of it.
Right, because you're responsible for the people essentially that are in your establishment. You have to make sure that people are following the rules.
Exactly, yeah.
And I think that's the case with any other rules. Every establishment has its own rules. You as an owner enforce them, right? So
yeah. So the biggest responsibility is for the owner or operator. Yeah.
Right. Okay, we have 5 minutes, so plenty of questions to go still. Andrea asks, my sister lives alone in Parry Sound and I live in Brampton. Can she come to my home in Brampton? It would just be myself, my husband, and my adult children who are living with me. And if she can, does she have to self-isolate once she goes back to Parry Sound?
So we do recommend that if someone is alone, they can have contact with one other household. And that's because we recognize it's very tough to be alone. And so you do need some social company. Now, someone living in Parry Sound coming into the GTA, for example, would be going from a lower risk to a higher risk. And so that might be less advisable. Really, we're not recommending that part. So what I would more recommend is that if she has someone in the Parry Sound area who she can connect with, one other household who she feels comfortable with, that might be a safer option.
Right. Jim asks, and we've talked about this a lot, but I don't know if we have a definitive answer. Jim asks, what are the long-term impacts of the virus?
Yeah, so we only have, 1 year, less than 1 year of data so far for people living with COVID, but we do know that some people are really struggling with some of the effects of having had this virus, with fatigue, all kinds of different things. I think it's as we do more studies, we'll figure out how much of it is actually related to the virus and how much of it might be related to, say, if someone had an underlying health condition. But there seems to be growing evidence that there are long-term effects from having had the infection in some people.
Right. And that's why we've talked about this so often, is that a lot of younger adults, especially, you might get over it, you might survive, of course, but you don't know the long-term impacts. And so the safest thing is to just not catch it.
Yeah, and that's different from, say, like getting the common cold. Like, most winters we all get a cold and we get over it, but we don't necessarily have those long-term effects. Yes. But we know from some other viruses, like, for example, West Nile virus that spread through mosquitoes, some people do have those long-term effects from that virus. So it depends on the kind of virus and the kind of infection that you get.
Right, absolutely. We actually just had this question, but let's reiterate this once again from Marie. Marie says, I'm a personal support worker and have always tested negative throughout the whole time of the pandemic. She did get sick in late January for the week and had most of the COVID symptoms, but there was no testing at the time. So how can she tell now if she had COVID back then? Is there any way to do that?
There's no good way to do that. What I can say to you is the first case that was identified in Canada was the end of January, and that was from a traveler who came here. Mm-hmm. I can also say to you very confidently that in January, February of last year, there were a lot of other viruses that were spreading that looked like COVID as well. We weren't testing for it, but there were a lot of other viruses that we know were circulating. And so that can also be something that you could have had. It's not guaranteed that it was COVID at that time.
Right. And a lot of these coronaviruses, like you've mentioned before, have very similar symptoms. You have a cold, you have a cough, you might have a fever. I myself in February was sick as a dog and was convinced it was COVID, but it wasn't, So there's a lot of different viruses that cause really similar symptoms.
Especially the flu. Last year, January, February, the flu was circulating. And those symptoms, again, can be indistinguishable from a symptom perspective.
Right. And so then let's talk about that, because this is a question coming in from Twitter. Boss Lady Forever asks, how did this year's overall death rate compare to previous years? And what about hospital intake or ICU? If it is the same or in line with population growth, why are we taking all of these extra measures for COVID?
So I think there's no question that the strain on the hospital system has increased this year, directly related to COVID. We actually normally see this time of year that hospital capacity gets strained. I know that working in the hospital, there's usually overflow beds, and you have to plan for respiratory virus season, including influenza. This year, influenza levels are actually extremely low. So we know that it's actually not influenza that's circulating. We know that COVID is circulating. And so that is definitely a change. I can certainly look up we won't have the final kind of numbers for deaths this year compared to previous years until well into the next year. But that's something that we can certainly look at to be able to answer that question. But, we can certainly say that deaths either from COVID or related to COVID have been identified for sure.
Absolutely. And that brings us to 1 o'clock. Thank you so much, Doctor, for this entire year. You have been an absolute champion for us, answering as many questions as we can. And thank you to everybody that has been participating in these sessions. We will be back next year. Keep an eye on our social media for when that's going to be. For now, I wish everybody a happy and safe holiday season and a happy new year as well. And to you as well, Doctor, happy holidays and happy new year.
Yeah, to you too, and to all the viewers. Thank you, everyone, for being so engaged and for these just wonderful, wonderful questions. And I hope everyone has a safe holidays. Absolutely. Bye.
Okay, bye-bye. Thank you, Doctor.